First of all, thank you so much for inviting me. I think it's it's a very important topic nowadays, and a lot of people all around the world are struggling with this. Some of our friends from back home has also called me to help them look at various different perspectives, and also how to gain some kind of mastery over this very difficult time. My practice in psychiatry is with adults as well as with children and families, and majority of the sessions are also about these things. So I do want to open up by asking people if they have any particular questions that they can pose or they can ask, and then we can start from there and start talking about what are some coping strategies.
Yeah. And I wanted to kind of start off a little bit by introducing you to our audience and whoever's listening. You have really wonderful credentials. Dr. Mohsin Khalique, he's an adult and a child psychiatrist. He lives in San Ramon. He's the neighbor. He's board certified from the American Board of Psychiatry and Neurology. And he's also the president of the Bay Area Psychiatric Group. So one of the reasons, obviously, I wanted to have a conversation with you. This is a casual Sunday conversation. We have, get together, bring our coffees, and, talk to people about issues which are very important to the residents in San Ramon. And mental health has been a big topic of discussion, of concern, to the point where even our police chief brought it to the council's attention that he saw a trend in a rise of 5150s, which are basically involuntary commitment in more of a younger population in San Ramon. And so I guess some of the things I would love for you to maybe share with me is you've been seeing a trend during COVID as people have sheltered in place, kids have not been able to go to school, get together with their friends. Have you seen a rise in more kids coming to you, more, wanting to seek out psychiatric services from you? Have you seen more adults do that? Kind of what is the trend right now that you've seen in the past few months if we've gone into shelter in place and, with the pandemic and people just worried about a lot of things?
I think I just joined in, so you can see me?
We cannot see you yet, but we can see your picture for sure. If you turn on your camera, hopefully we can see you.
All right, let me do this in a way. Okay, anyways. So let's, to answer your question, I think I've seen the trend going up in both segments. I've seen the trends going up in children as well as the whole families, because everybody is struggling with this. The whole families are struggling with their basic methods of coping with the stress have been taken away from them. And so, people used to go for walks, people used to go to the beaches, people used to go to movies, restaurants, kids used to hang out with their friends. All of that has been taken away from them. And because that has been taken away from them, they're struggling to find what are some methods to gain some level of normalcy, which they knew the normalcies that we got accustomed to, that has been taken away. So they feel really powerless. They feel frustrated. As a result, the anxieties have gone up. People who had anxieties and sadness and depressions to begin with, they have multiplied tremendously. And like you mentioned, the increase in hospitalization, increase in partial hospitalization, increase in the consumption of medication and psychiatric services, all that have happened recently because of this. So that's what I have been seeing in my practice also.
And how are you seeing your patients right now? Is it more telehealth? Is it more in person? Or What does your practice look like right now?
Yeah, so it's a mix of telehealth and phone sessions. I do a lot of phone sessions. The technical difficulties as I'm having with you, I've had those a lot of time with my patients. And so I have resorted to just doing phone sessions, but otherwise they are mostly telehealth.
And do you have any recommendations, suggestions for parents, as they are coping with teenagers being home, with, especially with young adults who are not now able to go to college, some of them, because the colleges are not open. So it's, their lives have been completely disrupted. So they're certainly facing some form of stress. Of the unknown. I've had a lot of people reach out that are businesses, obviously, that are feeling that stress because they're not able to open their businesses. They're, they're not sure, when their businesses will open, what that will look like. People have lost jobs and things. So I know those are like three questions in one, but I kind of wanted to bring to your attention with what is, people have been communicating with me, and I would love to see how you could answer some of those and how people can manage their stress with their kids, with their personal lives, and with the uncertainty.
Yeah, no, that's that you've kind of summed it all up, what people have been experiencing in their own lives, but they're also experiencing it collaterally if someone else's life is getting affected, right? I think by this time, 6 months into it, we all have somebody that we know personally who has suffered either the virus or has had some kind of fatality in their families or extended families or friends. So this is bearing very heavy on everybody. And so important thing is, you must have heard, majority of your listeners must have heard that, you cannot change what is happening to you, but you can only change how you react to it. And that's a very cliche way or cliche to be said to everybody else. But what does that actually mean? And how does that actually look like? What do you do? How do you change your reaction? So there are a couple of ways to change your reaction. First way of changing reaction is to find alternatives. How do you find alternatives, alternative behaviors, alternative skills? So previously, your family time was mostly involved in going for drives and going to the beaches and going to the movie theaters and restaurant. How do you change that behavior? The substance of bonding with the family remains. The substance of enjoying with the family and your loved ones and your significant others, that substance remains the same. It's just that the style changes. So the style can be that you start playing board games inside, you start playing cards inside, you start watching movies inside. If people who are religious, they have leaned towards religion. People who are spiritual, they have leaned towards meditation. Again, the behavior of how to find some kind of mental relaxation, either with yourself or with your loved ones or your friends, that the substance remains the same. The substance is of finding peace and finding relaxation, finding some kind of distraction from the stress outside. The behaviors can be modulated. Now, there could be multiple different types of behaviors, whatever works for you, as long as you are safe, as long as your family members and your friends and people around you are safe. Choose those methods, choose those substance. What I usually convey is the substance, and the substance of finding inner peace, inner relaxation, and bonding with your family members. That substance has to be redefined by various different skills.
Thank you for that. Yeah, I think you see people, certainly have adopted different ways of bonding and connecting together. You see a lot more families out on hikes, and you see a lot more families biking I've personally taken up more of biking because for me, it was more of just getting out, getting that workout, getting away from, I would say sometimes, just the mundane thoughts of what's going to happen next, how are we going to deal with it. And like you said, it is managing how we live life and, kind of altering how we do things. To that, if you go to sports stores, they're pretty much out of all outdoor activity equipment right now, because people have really found alternate ways of spending time with their families. And sometimes I feel it has allowed us to maybe disconnect and spend more time with our families as well than we did, when we were in the norm. So I guess the other question is people with businesses that have been impacted significantly, whether it's hair salons, nail salons, businesses that are still kind of at the tail end, gyms at the tail end of getting open. How do you, and that loss of income is huge for these small businesses. How do you recommend, and what suggestions would you have for some of our small businesses, local businesses, to manage this stress and make sure it's, it will impact them, but how do they manage that impact?
Yeah, that's a tough question. I mean, I've thought really hard about this. I've had many patients who have struggled with this. The both sides of it, right? There is an emotional side of it, and then there is a financial side of it. The financial toll really definitely trickles into their emotional part of it, because naturally they are struggling financially. So that start creating so much anxieties and worries and stress, and that stress trickles into their family life and their personal life as well. So it's a hard question. Again, the suggestions usually that have worked is what has brought much more internal peace for you. Naturally, I cannot give any kind of suggestions about the financial part of it, naturally, because that's not my domain at all. But what brings the internal peace to them, and what brings them continue to look forward, because it will come to an end. Unfortunately, it has gone this long for one reason or the other, but it will come to an end. So how do we help them look forward and be able to find some kind of solace in that when this will come to an end, I will still continue to be healthy and is still connected with my family. The uncertainties that people have gone through and the financial toll that has kind of ignited those uncertainties is immense. It's just, nothing that we have seen. And so in order to find hope in all of these things become very difficult. But it goes case by case. But since you're asking me a question that may help majority of the people, majority of the time, again, the substance of it is how to bring the internal peace for you and to be able to continue to move forward and finding hope. Now, finding hope can be, again, what brings happiness and joy to your family, to yourself, to your significant other. But looking towards hope becomes important. The internal state of mind is actually based upon what we tell ourselves, right? And when we start telling ourselves things will be bad for a long time, as opposed to what is it that I can do right now to create an internal state of mind, which is predominantly hopeful. So that internal narrative becomes really the driving force of hope. I hope I'm making sense. If I'm not, then you can ask me for clarification.
Yeah, no, most certainly. So I would like to invite any of my audiences if they have any questions that you might want to ask Dr. Mohsin.
Yeah, sure. Yeah, Doctor, thanks for being here. So while I think it's great that California is taking a very cautious approach to COVID, maybe compared to the rest of the country, I'm also sort of worried that this collective anxiety that is happening right now that is sort of manifesting itself in ways that are bad for the culture? I know this is maybe a public policy question, but like, to what degree should we be balancing mental health and these reopening questions? I know these are very complex questions, but I'd be curious to get your thoughts.
Yeah, no, that's a very poignant question. It's a long answer, but I'll try to summarize it in the best way I can. Mental health, when I became psychiatrist, the first thing I learned is mental health and psychiatric underpinnings are predominant in every health-related issues. It could be as simple as having a flu, and then the mental health of that individual starts getting affected. But the collective mental health of moving towards frustration, that becomes the crucial part to look at. How do we bring the society out of feeling so frustrated that we start getting angry at each other? And so the tolerance goes away, right? That's the thing that we are all struggling nowadays in the last 4 to 6 months, that the tolerance has become so short. And that's because, all the coping strategies that we knew have been taken away from us. So we're extremely intolerant. We become reactive quickly. We become agitated quickly. And that is the collective psyche of the nation right now, for one reason or the other. So how to help the society, how to help the nation to do that? Naturally, it has to come from leadership. But when it comes to the individual's practice, the individual practice of developing hope, developing nurturance for yourself, and compassion for the others, because everybody is suffering. It's not that I'm suffering and you're not. Everybody is suffering. The message has to be, somehow the leadership has to take the message of compassion. And right now, because of lack of compassion, there's so much intolerance that we see. Now, how you reach to compassion, that's your path. Your path can be a religious path reaching to compassion. It could be a Buddhist path, or it could be a non-denominational path. But I think the message of compassion, because everybody is suffering, that remains a very important thing to decrease the individual and collective anxiety.
Thank you.
I have a question for Mohsin. It's probably a couple of those questions. So do you have any sort of data, what age group is mostly impacted due to COVID, or is it just everyone? And secondly, what sort of impact it has on the relationships? Because many times couples leave their home, so they do get their, call it me time, away from home, and now 24/7 you're home. So those things. And lastly, sorry, I'm asking too many questions. Have you reached out to any of your, at least city council or anybody, and give suggestions? I know nothing written in stone and you can't, but at least can you give some sort of guideline to people that, hey, these are just the suggestions. You can pick and choose whatever it works for you. But have you reached out to, as you were saying, it's a leadership decision, but have you reached out to any of the council or mayor or anybody just to put up your suggestions?
So those are excellent questions. Let me address the last one first, because that's an easy one. I don't think I have, and I don't think I have been approached also. I think the majority of the time, given the pressures of day-to-day existence, things get lost. But I do appreciate you pointing me in that direction, and maybe that's something that later on I can work with Sabina to see if we can formulate something which is a cohesive statement that can be propagated. So I do appreciate you pointing me in that direction. The first two questions you asked, one is about the data. The data is quite obvious right now that everybody is getting affected. Every age domain is getting affected. There's not just one strata of population or age group. So everybody is struggling with this. The second question about the relationship, initially there was some data that came out from European countries that domestic violence increased. And then a friend of mine from back home in Pakistan, he approached me and he was also sharing the similar data that domestic violence incidences have increased tremendously during these times. I don't know if we have that data in US. I know that in some data came out from France that their homeless shelter got filled. Their women's shelter got filled very quickly earlier to the degree that the French government actually started subsidizing women coming from battered relationships to be placed in hotels because the women's shelter were filled to the brim. So that's the only data that I'm aware of. How to help in that situation? Again, it goes case by case. However, the take-home message again remains to be that if we can find some me time, individuals can go for walks, bike rides, like Sabina said. Some me time is important. So that's number one. Number two, conflict resolution is something that can be taught individually, but as well as collectively. Conflict resolution is about understanding, communication, and listening, and then responding after listening. A lot of time in the heated moments when couples or families or parent and child or anybody is having an argument, listening goes out of the window and it's just reaction. So we keep reacting on the emotions rather than listening and then responding. A lot of time when I'm teaching this to families or to couples, you see how hard it is for them to let go of that reactionary pattern. So those patterns sometimes have to be adjusted, and that's what I would convey to your audiences, how to be listening a little bit more and understanding that the other person is suffering. And due to suffering, we react. It's okay to react. We are there for each other. We listen, empathize, convey our point of view, and then move forward.
Thank you so much.
Thank you, and thank you, Farooq, for asking that question. Kind of leads that we have another 5 minutes or so together. So leads me into, Mohsin, how can cities come together to support our residents based on what both Dave said and Farooq said? These are the things that are top of mind for myself and the rest of my council. Obviously, we've been getting the data on both domestic violence, and we've been getting some of that information on our youth and how we've had to do some, we've had a rise in youth mental health issues. And we have resources on the city's website that can point you to where you can call in and what resources we have available. But if you have suggestions and recommendations, and most certainly one of the reasons for bringing you on was to start that conversation and how we can work together to support our community.
Yeah, I don't know if my answer would be much more in the lines of how to design a policy, because usually the way I see things are much more in a overarching way. So the overarching principle that has worked for me and that I teach to individuals is compassion, right? Especially when people are hurting. So when a loved one is hurting, when your friend is hurting, when your spouse is hurting, when your kid is hurting, when your neighbor is hurting, how do we extend compassion? Now, if I say how do we extend compassion, how do we transform that into principles and behaviors that can be helpful to city? What kind of strategies city might have to take in order to bring the city into living a much more compassionate life? There are many, many methods to do that. For example, holding some kind of collective online situations where people are able to share and be able to vent. If I could be of any help in generating that, I would be more than happy to volunteer my services for that. But the 2 or 3 things that help people, one is their natural desire to vent. People like to vent about what they're going through, the difficult times that they go through, and a lot of people just feel better after venting. The second step goes to healing, right? How do you heal what a person is struggling with? What is the internal damage or the trauma that they are going through? And right now, the whole nation and the whole world is going through trauma. So the healing component has to be either individual or collective. The collective part is, I think, what we are talking about. How do we generate either online or in person where people can heal together? And then the third part comes as the compassion part. That after healing, how do we extend that healing to the other individual in our lives? How do we formulate those things? I don't know. I think that's beyond my training. I will keep thinking about it after this talk and maybe share some of my ideas with you if it comes up.
So I think collectively what I'm hearing is you want, the compassion, the making sure people feel they can vent out, and then how as a community we spread that message of compassion and being tolerant of each other. I appreciate that. Adil has his hand raised, so he has a question. Adil?
Yes, thank you, Sabina. First of all, thank you, Sabina, for organizing such a wonderful discussion. I think this is very pertinent to our current times. And Dr. Riyaz, assalamu alaikum. Thank you for coming and answering some of our questions. I guess I'll just ask you a couple quick questions in extension of what Dave and Farouk has already asked you. One is that, if you don't mind sharing some of your thoughts about now that the economy, so-called, is like trying to open up, rightly so. So schools are opening up, kids are going back to school, parents are going back towards work, and that's what's being recommended. However, throughout the worldwide, we see a continuous increase in the number of cases, especially in the US. It's just leading all the countries. So there's a lot of anxiety and anxiousness that is happening in terms of how do we go outside and resume normal life. Do you have any recommendation about what can we do to calm our nerves as we are resuming towards a sort of formal life?
Yeah, so some of the things that I mentioned earlier in our discussion, I would go back to those of how to find some kind of internal peace. What are your methods of relaxation? What are your methods of bonding with their family? Because I usually try to put it in a context of substance and style. So a lot of time when people lose the style of whatever it was, a style of love, a style of sorrow, a style of bonding, when people lose that style, they feel that they cannot convey that substance. And so they feel very, very frustrated at that time. So I try to bring people back to the substance and let's formulate a different style. Humans can always adapt to different behaviors. So what are the behaviors that convey that substance? So bonding with the family can be within the confines of your house. Bonding with the family can be going for a walk together. Bonding with the family can be taking a long drive together, going to our national park if we don't have a smoke at that time. So how do we stay safe? How do we continue to practice what is needed to be practiced right now? Absolutely, to decrease the spread of the virus, but at the same time, find that substance. I can suggest many, but it really depends upon what is essential for you and for your family to have that substance to decrease the anxiety that you're feeling.
Awesome, great. And just one other follow-up question from Farouk talk. Thank you for providing your insight in terms of relationships and a sudden increase, of course, in domestic violence. Do you know of if the increase in domestic violence is just against women, or has it been cases, or are there any reports about increase in domestic violence against where the man is the victim?
So majority of the data that has come out is exactly the same data that we used to see before, that more than 85% of the cases are battered women or abused women. There are cases against men also, but there are very, very few. Now, domestic violence is one part, and then the child abuse is a second part, right? So then naturally, when families are together all the time and the pattern of interactions in the families are usually abusive, dismissive, traumatic, then that plays very heavy role on child's developmental age and developmental emotional development. So those cases have increased also. I am not aware if there is a data from Child Protection Services where the children have been removed from houses more in these times. I'm not aware of that data. I don't think that data has come out because it's only been 6 months. So it usually takes a little bit longer for that data to come out. As far as the women versus men, women cases have increased more, and that is also because to begin with, women cases are more. Women are more abused or battered as opposed to men.
Awesome. Thank you, sir.
Thank you so much, Mohsin, for joining us. I think we're time to wrap up. This is a very important conversation. I think something we can continue to have. And there's a lot of interest, and we're all learning how to do this better. I know to Dave's question, it is how do we strike that balance between opening up and making sure, people don't continue to stress. There's, California is doing it in a different way. New York is doing it in a different way. Midwest is doing it in a different way. And I honestly think even the governments don't know yet what they're doing. We're relying a lot on data, but the world doesn't run on data all the time. It runs on compassion and emotion. So hopefully we will bring that back more into our, as we lead, if you will.
So I do want to thank you, and I do want to really appreciate the audience and their questions. They were really, really good and productive questions. So I hope that I was able to convey some of my way of looking at this, and at the same time be able to have a little bit of a input into creating a little bit more compassionate society. But thank you so much for inviting me.
Thank you. Appreciate it. Thank you, everybody. We'll see you in a couple of more Sundays.
Thank you.
Care.
Thank you.
Bye.
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 Bye.